Hi, everyone. Adnan here with another awesome episode of Digital Health on Air. Super excited to have an amazing guest, a guest that is different than some of the usual suspects we have from various health systems and in parts of the healthcare ecosystem. But Nassar has worn that hat in the past, but Nassar Nizami is the Chief Information Officer at Exact Sciences. And so today we'll be talking about outcomes from this amazing company that are making in-home colorectal cancer screening a reality for people across all parts of the country at scale. And of course, Nassar's perspective on the health impacts of meeting patients where they are. So Nassar, welcome. Thank you, thank you, thank you. And look, you've been a health technology leader at a variety of different health systems, be it Yale New Haven, you're Presbyterian, Jefferson Health most recently. Then you've seen CISO roles, CIO roles, innovation roles. Like, what brought you to Exact Sciences?
Well, Adnan, first of all, thank you very much for having me on your webinar. Yeah, I have been fortunate to work for some very large and prominent academic medical centers, medical schools, insurance providers for the last 20 plus years. And at one point in time, I thought, all right, this is it. This is how I retire. It's awesome. But then the opportunity at Exact Sciences presented, and when it presented, I thought, all right, let's check it out. And I was so impressed by the quality of leadership at Exact Sciences and the sense of mission. So mission is to eradicate cancer, but preventing it, detecting early and guiding personalized treatment. And working for healthcare systems, now mostly all not-for-profit organizations, the sense of mission is really strong. And I felt, wow, if there is any organization outside of healthcare, this is it. And most people I met were touched somehow, everyone, myself included, touched by cancer and just dedicated to the mission. So quality of people, vision of the organization, this was a big draw for me.
Awesome. Well, thank you for finding that calling and for putting your energy and efforts and bringing your experience and leadership to such a noble mission. We all see the headlines these days about the rise of cancers across the U.S. population, across the world, and among younger adults in particular. And typically, these are cancers that have been associated with older people, but now we're seeing the rise in younger populations. And so for our listeners here on Digital Health on Air, will you give us a primer on the rise of cancer and how screening recommendations are really changing?
Sure, great question. Look, colorectal cancer is rising on younger adults, which research are showing a growing incidence under the age of 50. As a result, in response, screening guidelines were updated in 2021, lowering the screening age from 50 years to 45 for average risk individuals. Now, younger patients generally tend to be healthier. They don't see their doctors that regularly, may not have a PCP, which all makes it very difficult to reach for education about the new screening limits, right? A new screening age. We at Exact Sciences are focused on raising awareness within this group about the importance of early colorectal cancer care screening. And we believe that a non-invasive test like Cologuard offers an easy to test home option for those who may not seek regular care. But the bottom line is that there is a need to increase the education in the younger population, just because the rate of colorectal cancer is increasing in a much higher rate.
Okay, this is helpful. Thank you for kind of anchoring us there in the reality. For colorectal cancer in particular, we know screening is so incredibly important. And so it's not fun to get a colonoscopy, right? Like, we know, working with health systems across the country, that in the GI department, in that particular service line, like, colonoscopy is incredibly important, incredibly valuable, both from the treatment opportunity as well as like the value of doing that screening test. But people don't want to do it, and it's often a canceled or a missed appointment, or people don't prepare for it in the right way. So not convenient and hard. And remember, we talked to TK Tareen Kapoor at Virtual Health a couple episodes ago, and he really reminded us about how convenience is critical and meeting people where they are is critical. And so you guys have partnered with them, and in terms of delivering the Exact Sciences Cologuard test to people where they are. So would love your point of view and really your thoughts on like how you're able to do this, really drive convenience, meet people where they are, and ultimately impact their health in the ways that we all want to impact their health.
Yeah, look, first of all, Dr. Tarun Kapoor is a great, is a good friend and a visionary leader in healthcare ID. And yes, we are really proud of our partnership with him and Virtual Health. So, look, Cologuard's at-home screening option plays a crucial role in making colorectal cancer screening more accessible and convenient, especially for patients who find colonoscopies just unpleasant or inconvenient. Now, by offering convenience, patients can complete their screening at home, privacy of their own home, without needing to take time off or arrange transportation. These are some of the things that most of us were fortunate don't think about taking a day off, transportation.
Absolutely. Absolutely.
But recognizing that this is not necessarily an option for many people, right?
Absolutely.
So convenience matters a lot, and more convenient access to screening result in early detection, which is critical in cancer. Early detection makes the cure and treatment so much, the probability of success so much greater, right? And
Absolutely.
this is what we believe, right? So early detection, convenience, early detection dramatically improves treatment outcomes, right? But the easier it is for patients to screen, the more likely they are to complete it, and ultimately helping prevent cancer through early intervention, essentially, right? Now, touching on some of the cool digital aspects that we work with, and I'm happy to go in detail if needed, but in addition to convenience, right? We have made improvements in the ordering process. There's friction in healthcare system, many different stages, and Virtua has done an excellent job in reaching out to patients, and we actually model some of our upcoming work based on their approach. Now, in addition, people can order Cologuard through Cologuard.com, where a virtual provider can just assess and order on their behalf. Once the order is placed, we found that continuous reminders, encouraging patients to complete, really increase the screening rates dramatically. And lastly, we have taken great care to ensure that test results are very simple, timely, and very simple to understand for the patients.
Awesome. Okay, this is what you're seeing me kind of jump out of my chair here. I think engagement is a terrible, like patient engagement is terrible, right? None of us want to be engaged. We want to get to success, and success can mean a lot of different things. And I think what you're articulating with Cologuard is like, it's convenient, it's easy, it's simple to understand, it's timely, it's meet people where they are. And so whatever someone's version of success is like, it was easy, I understood it, I did it quickly. Oh, I got the health outcome I wanted. It prevented something that could have been worse. Like this is the magic wand in a lot of ways to really deliver success at scale. And so you started touching upon some of the digital elements, but let's go there. Like let's talk about like how do you make this magic happen for people who are busy, who have lots going on in their lives, and the last thing they're thinking about often is like a preventative colonoscopy test.
Yeah. So look, first of all, I just say over the last 10 years, Exact Sciences have tested about 16 million completed screenings,
Yeah,
which is approximately 1 every 20 seconds, right? So just highlighting the impact of on colorectal cancer screening traditionally. Now, there are many things that go into making this program a successful program to screen as many patients as we can. One of them is patient navigation program. Over the past decade, Exact Sciences has continuously optimized our patient navigation program that accompany every kit that we ship. Now, this navigation program is based on hundreds, if not thousands, of experiments that our teams continuously have done and continuously do around what are the outreach channels, languages, messages, timing of the messages, all designed to improve patient outcomes. Now, our key learnings from this is that, look, first of all, digital outreach, the patients tend to prefer digital outreach, okay? Especially if there is a clear call to action, right? If you have a direct call to action, it's crucial in motivating the patients. to complete their screening. And ease of use, right? So language, ease of use, enhancing the simplicity of the kit and instructions. So that plays a part into this. Our partnership with healthcare systems is crucial. We have direct interfaces with several hundred health systems and thousands of hospitals by way of several hundred health systems. It makes the ordering and receiving result easy. We have a robust patient portal, which is part of our digital story. We also send patients are also able to look at results in their native EMRs patient portal in addition to our patient portal. And we believe in providing options there. That is part of um, um, our success. As an example with Virtua, another example of digital co-branding, which we did with Virtua in terms of SMS messaging and outreach. Is just our experiences that patients are typically familiar with their health system, right? And when we co-brand with health systems, the adherence increase dramatically, right? Very recently, this year, we launched a campaign in Spanish, which we're really excited about to serve the Spanish-speaking community. So we have a robust patient navigation system. We're continuously improving it, trying to segment as much as possible, different channels, different languages, different messages. It's a journey, but I'm really impressed by the program that our team has put together, Exact Sciences.
Okay, thank you. This is a perfect segue. You're the CIO of an innovative diagnostic and screening company, but you've been the technical lead, the technology leader within healthcare itself. And so I think you started touching upon a lot of the ways that you're thinking about the entire ecosystem,
That's
not
right.
just patient need to get them a screening test, but like how to make it easy. So like tell us about like the previous hats you wore and how that's helping you effectively deliver these screening tests to as many people as possible.
Yeah, look, it's an excellent question. So, like when I joined Exact Sciences, I didn't know a whole lot about life sciences, zero experience essentially. But one of the reasons I joined was that I knew the customers really well. So I've worked with health systems, providers, patient, that whole ecosystem I understand very well. So, and I thought that, yep, there is certainly value that I can add. And in talking with the leaders here, in deepening our partnership with healthcare systems. So, my learning so far, not only 1 year now, but in general, and talking with other now life science leaders, especially technology leaders, I think there is a gap. Healthcare provider world, I think, is somewhat isolated from life sciences, and be it
Mhm.
pharma, diagnostics, and so forth. So in many ways, there is a transactional relationship. There are some relationships. I'm not saying all of it is transactional. By and large, at least on the technology front, it is very transactional, and in many cases, just non-existent. And that's the bridge that I am, at least at Exact, trying to bridge the gap there. Uh, there is tremendous value, and we're already seeing in connecting, data sharing, working on different campaigns together. All right, so just partnering, if nothing else, raising the level of awareness, right? And using technology, both, because we have patient navigation program. Health systems typically have patient navigation programs. Some health systems are very advanced, others are not, especially if you think about the small to medium-sized organizations, they really don't have
Absolutely.
teams. And I've lived that life, right?
Absolutely.
And we can help them. We can co-brand, we can run with the navigation program, we can work on things like data exchanges. In some cases, we are working with the same vendors. Healthcare ecosystem even though we are life sciences and healthcare system, there is some level of overlap, and there's at times I have found there is benefit in going to vendors, especially EMR vendors, for instance, right? And just making a pitch to say, hey, if you do this or this, is going to help both us and healthcare systems, right? So partnering with healthcare systems to make a case with certain vendors, especially EMR vendors. So I see still there's a gap there, And there are significant opportunities to collaborate for life sciences companies to collaborate with healthcare provider organizations.
This is one I love this perspective because I think there is definitely a convergence. Like if we think of really total health and wellness, right? Like everyone can't keep operating in their respective swim lanes. They have to start swimming together, and maybe even in the same swimming pool at times when it's appropriate. And so you guys are Exact Sciences is an innovative company. You're thinking beyond just consumer wellness and thinking about like how do we unite the focus on the healthcare consumer or the patient. You started touching upon things, but like you have a really unique vantage point, like advice for the clinical side of healthcare. Um, you touched upon some of the technology vendors, be it the EHR companies like Luma, who are on the patient success side of things. Like, how should we be learning from each other to ultimately and working more effectively together to drive the exact type of outcomes that we're talking about here?
Look, instead of my advice would be instead of thinking this as a vendor-vendor relationship, think of this as a partnership. That's I think the just a significant change in the way we approach the problem, because often companies like Exact and others are thought, hey, vendor. Even when I go to like conferences and such, people are like, oh, Exact, you're a vendor. I'm like, no, no, no. We are a lab. We're a healthcare provider. We same HIPAA rules apply to us. We have patient portal, patient come to us, so on and so forth. So first thing is, hey, think of us as partner. We have some unique data, especially when it comes to cancer. We are very focused. So health systems leaders have a million things on their mind. And look, I live in that life, and I really appreciate the complexity of health systems, and just you don't know what type of patient is going to show up at your door. Our focus at Exact Sciences is to eradicate cancer. That's our mission. It's a very focused mission, and we have the expertise to help with things like patient navigation, improving adherence, early screening. And we have other products. I know that our discussion has been focused heavily on Cologuard, and that's what I've been using, but that's not the only product. We have the other products. So think of it as partners, reach out, work with us on things like early screening, adherence campaigns, care
Mhm.
closures, which is in everyone's interest. Is the care, think about care, we think about healthcare provider, us, we all, and patient, everyone is interested in care gap. And that's where I think a deeper partnership with clear data exchanges, with peers, with healthcare providers, with Exact Sciences, I think is going to just benefit everyone, but most importantly, the patient.
Awesome. So we often think about things as like the entire patient or healthcare consumer journey. I think you started touching upon all different parts that you interact there. You touched upon some of the success with Virtua, but just in your seat today, is there an example, be it Cologuard or another product where you've said, hey, we really helped that entire patient journey and we're thoughtful in different ways and just something you're proud about or think really is novel in the way you've done it?
So look, again, I'll go back to our campaigns and patient navigation program, where the percent increase in adherence could easily mean, depending on the population that we are going after, several hundred, additional kits, and some percentage of those kits being positive. So there's tremendous, I think, value that we put in improved adherence. And with a few health systems now, we ran campaigns in a true partnership from the very beginning, where we established governance. We came up with messaging, and different health systems have their own priorities on what that messaging should look like, who should send us, whether it's health system, whether it's primary care. We work with health systems, sending that order, us receiving the order, right? And then launching a navigation program, whether it's co-branded or not, but working with the health system to close the loop essentially, right? Until the result is delivered to the health system. And then it's, of course, health system takes that on, especially for positive patients, to the next step. Now, there is still many opportunities, I would say, to both do an outreach to more patients and to improve the outcomes. Like one of the gaps that I see today is in many cases, once a patient is tested positive, we do deliver the result. But then what happens afterwards is not clear to us. It's between health system and patients. That's an area where we can partner better with healthcare systems in that, if a patient does not follow up with colonoscopy after they have tested positive for Cologuard, perhaps we can intervene or help in some way. So just one example of where we can improve, but I'm really proud of our adherence. We have done, well, team before me in the last year since I have been here, I've made tremendous progress with improving adherence, running campaigns and care gap closure campaigns with different health systems. And every time we do that, we see results in number of patients tested and number of positive results, which essentially means someone got an early detection and hopefully they will follow through and get an early treatment.
Well, I mean, one, again, thank you for your leadership and an incredibly noble mission. And this is real impact at scale. And I love the example you shared of how when it's all stitched together, it really has an outsized impact beyond just like what a test can do at any given point. You started touching upon it, but I'm going to give you the magic wand. You have the magic wand. And if you could change one thing, right, wherever it is to help you deliver upon your mission in a better, more effective way, like what would be that one thing you would change?
So we would love the ability to partner with healthcare system to send a message to the patients together as one organization. We would love to present ourselves to patients in a co-branded way so that you know it should be transparent to the patient in our mind, like, hey, whether it's Exact Sciences or a healthcare system, that I think from a healthcare system perspective, that probably is the most impactful thing that we can do to trust each other with messaging. And it can be either side, it doesn't matter, but true partnership. And look, being on the other side, I recognize that especially technology teams at healthcare systems have a million things on their plate. So, and this is one of that, many, many, many things on their plate. And this is where a true partnership can go a long way, where Exact Sciences can take on certain tasks, a good number of tasks, and automate. We have the technology, we can partner with health systems, and if there's one ask, that would be if you're not if you can trust us, you don't have the bandwidth, let us do the work. We have proven track record of improving adherence and screening.
Awesome. Well, that is an achievable wand waving, and one excited for you guys to continue your work and the impact you deliver, and for us to play a part in of course helping make that happen. This has been awesome. Like you've been incredibly generous with your time, super candid, and you allowed me to nerd out and go into details, but then also hit me with kind of like your strategic outlook. So thank you so much. Incredibly inspiring. You're meeting patients where they are. You're delivering upon like all of our expectations as consumers, and in a very tangible way to really drive better health outcomes. So thank you, thank you, thank you.
Thank you very much again for having me. Look, I certainly hope that we'll be able to work together. But great talking with you.
Awesome. All right. Thank you so much. That's
Take
today's
care.
episode of Digital Health on Air.